Crystal. Today I'm going to perform a head-to-toe assessment on you. Is that okay?
Yes.
Okay, so we already did his vital signs. They were within normal limits. We checked his height and weight. We did his vision test, which was 20/20, and vitals were stable. So I'm going to look at your wristband. Can you tell me your full name and date of birth?
Gerald Romano, 11/20/1958.
Very good. And can you tell me what month it is?
It is October.
Okay, what are we doing today?
What were we doing today?
What are we doing?
Oh, we're doing this assessment.
Very good. And who's the president?
Joe Biden.
Okay. Very good. So you're sitting upright. You, your mood is pleasant. Your cognition is great, and you're appropriate, and your mood is appropriate with what we're doing. Next, I'm going to inspect your head. So we're going to look at your head. It's within normal size. I'm going to palpate. Very good. Checking for lesions or masses. Looking through the hair. Hair distribution looks good. Next, I'm going to ask you to smile, frown, close your eyes really, really tight. Very good. Puff out your cheeks. Perfect. Very good. And next, I'm going to check your eyes. So I'm just going to inspect first by looking at them. Very good. And I'm going to shine a light. Oh, can you take your glasses off for me? Sorry. Let me just check underneath here. Perfect. It looks normal. Next, I'm going to shine a light. Very good. Very good. And I'm just going to ask you to follow this. Okay. And all 6 gazes. Okay. And I'm coming in. Perfect. Very good. And if you need to put your glasses on, you can. I'm going to ask you to look at something in the distance and then look back at my light here, and look something back in the distance and look back at my light here. Perfect. Nice. All right. Oh, awesome. I got to check your eyes with the otoscope here, so give me 1 second. Take your glasses off one more time for me. Okay. All right, and here we go. Just take it's going to be kind of bright though, okay? All right, and look at that.
I gotta move.
All right, very good. All right, next we're going to do your ears.
I know what you do.
Before we move on to your ears, I'm just going to check, you can put your glass back on, check some sensation on your face. So if you could close your eyes and just say yes if you feel me touching you.
Yes. 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 Yes.
Awesome, very good. And close your eyes. And what does this smell?
Coffee.
Very good. Okay. All right, next I'm going to move on to your ears. Okay, I'm going to inspect, check for any drainage. Good, I'm going to palpate. Lesions or masses. Next I'm going to look inside your ear. Very good. I'm going to look inside this one. Turn your head a little bit. Thank you. Hold it up. Alright, very good. And next we're going to do the whisper test.
Red apple.
Baseball player.
Baseball player.
Alright, very good. And next we're going to do the tuning fork test. And tell me if you hear that in both ears. Feel it?
Yeah.
Okay, perfect. Very good.
What's that?
Okay, next I'm going to inspect your nose. Take a look, very good. Good, no drainage, it looks good there. Check for patency, if you can take a deep breath, twice each side. Perfect, very good. Next, next we're going to do your neck. And I'm going to inspect your neck. Very good. I'm going to palpate.
Yeah, that's spiders.
Okay, checking on those lymph nodes. Awesome. I'm going to check your frontal. and your maxillary.
Okay.
All right, and also I'm going to check your temporal artery, palpate that as well. Good, and if you could open up your mouth and move your jaw side to side for me. Perfect, very good. All right, next I'm going to auscultate your carotid.
Cool.
Very good, I'll do it for this side for the video. Very good. All right, and
That's it?
next I'm going to check your thyroid. You could swallow for me. That's good. Very good. I'm palpating my trachea as well. Next, I'm just going to ask you to open up your mouth because I'm going to inspect your mouth. Very good. Tongue up, down. Good. Up one more time. Yeah. Side left and right. Stick your tongue out. Yes. Good. And now say ah.
Ah.
Perfect. Close your mouth and stick your tongue out one more time. And it's midline. Awesome. Okay. So next, I'm going to do your arms here. I'm going to check for skin, temperature, skin turgor. Very good. Can you lift your shoulders up? Perfect. Very good. And elbows, can you bend and straighten out? Straighten. Perfect. And push up. Good. Push down. Now push down. Perfect. Good. All right, and I'm just going to palpate each joint. And here, I'm going to palpate your wrists. I'm going to each finger here. Check capillary refill. Very good. Next, I'm going to check this lymph node here. Very good. Palpate that. That's good as well. Next, if you could turn your head over, I'm going to ask you to close your eyes, and I'm going to get a number, and you're going to tell me what the number is, okay?
3.
Very good. Next, I'm going to give you an object. You can play with it,
Hear that, Liam?
and you can tell me what it is.
I think it's a car.
Okay, very good. All right.
All
All right, next I'm going to check your reflexes. So just relax your arm here a little bit. Yeah, no,
Does
how about we
that
put it up
hurt?
here?
Grandpa, does that hurt?
Very good, I'm looking for that. Next I'm going to check here. Okay, next I'm going to hold your arm up for me. And, yep. Very good, and I saw the reflex right in there. Next I'm going to ask you to close your eyes, and you're going to tell me sharp or dull, okay? Ready? Close your eyes.
Sharp.
Or soft,
Soft.
okay?
Sharp. Soft. I think it's sharp. Soft.
Okay, very good. That was good. All right, next we're gonna do your lungs. So if you could just come sit at the edge of the chair, very good. And I'm going to first inspect scapula and your chest wall. You're not breathing labored. You're not in any distress. And next I'm going to palpate. Good. Next I'm going to ask you to say 99.
99. 99. 99. 99. 99.
Very good. Next I'm going to auscultate. Take some deep breaths. Very good. Okay, and I'm just going to ask you to stand up. I'm going to check for your chest expansion, so take a deep breath. Very good, perfect. And next I'm going to ask if you feel any pain with this, okay? Any pain?
No.
Any pain?
No.
Okay, and then next I'm just going to percuss. Good. All right, so after this, I'm gonna ask you to lay down. Good. Next, I'm just going to ask you to turn your head to the side for me. Okay. And I'm going to hold some pressure right here. Any pain?
No.
Okay, very good. And next, I'm going to just look at your chest wall here. I'm going to palpate. Next, I'm going to auscultate. And you would auscultate for a full minute here, listening for S1, S2. Next, I'm going to listen to all cardiac points here. Very good. Okay, next, go down to your abdomen, going to inspect your abdomen, check for any lesions or masses. Next, I'm going to auscultate. Very good. I'm going to auscultate the arteries. And the femoral ones as well. Very good. And before I forget, also you would listen to the cardiac with the bell of your stethoscope as well. Next, I'm going to we'll put some pressure on you, and I'm going to just palpate all throughout your abdomen. Very good. I'm just going to feel your liver and your spleen, but you shouldn't feel them, which is a normal finding. Nice. Next, we're going to move down to your legs. You would inspect your legs, looking for any edema on both legs. You would checking for hair distribution, making sure your hair is growing in evenly. Next, I would, if you're not wearing jeans, of course, we would do all the way up the leg, but I'm going to ask for sharp or dull, so just close your eyes for me. And is this sharp or dull? And what is this?
Soft.
Okay. Is this?
I think it's soft.
It's hard to tell with the jeans on, but okay. You would do that up and down the leg on both sides. Next, we would check the lymph nodes in the groin over here. Check the femoral pulses. Bend your knee. We would check the popliteal pulse. You can flatten it back out. DPs and PTs. Next, we would do range of motion. So push your foot up to the sky, like bend backwards. Bend your foot back, like flex it. Yep. Now push down like you're pedaling. Perfect. And can you bend your knee for me? And out. Perfect. Very good. And can you try and push your legs out that way? Perfect. And in. Perfect. Very good. And next, I'm just going to check. You tell me if you feel this vibration on your toe. Perfect. You tell me when you don't feel it. Did it stop?
Yeah.
Okay. Very good. Good. Next, I'm going to ask you to sit on the table so I can check your reflex. Alrighty, are you comfortable?
Mm-hmm.
My exam table. Okay, I'm going to check your popliteal. Oh, there it goes. Perfect. Next, I'm going to check your Achilles. Back, and your foot should move from the front. Perfect. Very good. Next, if you could just close your eyes and just tell me if I'm moving your toe up or down.
Up. Down.
Okay, perfect. And I forgot to do that as well on your fingers. If you could close your eyes and tell me if I'm moving your finger up or down.
Down. Up.
Perfect. Okay. Very good. Next, I'm going to ask you to stand. All right, and I'm going to check the curvature of your spine here. So, I'm going to come on this side. Yep, just bend. You don't have to touch your toes. Just bend down so I can check the curvature of your spine. Perfect. Very good. That's good. And then just bend back, arch back a little bit. Yep, perfect. Okay, very good. Good. And then next, I'm just going to ask you to walk. Okay, and back. Okay, and then next I need you to do the toe, heel toe. Yeah. Perfect. Very good. Okay, and come back. Perfect. And then just hop on each foot. So hop on the right foot and then hop on the left foot. Perfect. Okay, good. Next, I'm just going to ask you to close your eyes, feet together. Okay, close your eyes. Perfect. And you can put your arms out straight out for me with your eyes closed. All right. Oh, no swaying there. Okay, good. And I think that's it. Thank you.
You're welcome.